Okay, good afternoon, folks. Now we've got discussion C for you all. It talks about neuropathy, what it is, what causes it. So we'll get into that right now for today's discussion C. Please join me in the presentation I made for y'all. Sit back and enjoy, please. Okay, let me. Okay, what it means? Nerve pain and tingling in the extremities. When someone experiences pain or tingling in their hands or feet, it may signal neuropathy, a broad term for nerve dysfunction affecting the limbs. These symptoms can reflect problems with the peripheral nerves and that transmit signals between your brain and body. Okay, age-related vulnerability. Aging naturally reduces nerve cell count, making nerves more prone to dysfunction. Damaged nerves recover less effectively as we get older due to weakened regenerative capacity. Medical causes. Several underlying conditions may trigger neuropathy: diabetes and autoimmune diseases, chemotherapy treatments, vitamin B12 deficiency affecting 20% of adults over 60, untreated hypothyroidism, kidney disease, and obesity. These conditions impair nerve function directly or disrupt natural hormonal pathways necessary for nerve health. Okay, next steps. If you suspect neuropathy, the article encourages identifying root causes through medical consultation. Addressing correctable factors like nutrition, defects or chronic disease management, monitoring progression, especially in older adults, due to heightened risks. Okay, give me 1 second, guys. Set this down. Would you like a comparison of standard versus emerging treatments for neuropathy, or perhaps how this fits into larger trends in age-related cures or care? I'd be happy to help deepen the contexts. Absolutely. Strengthening nerve health, especially in the context of age and neuropathy, is a holistic endeavor. Here's a breakdown of impactful lifestyle changes based on the surrounding contexts of the uh, page and extended insights. Okay, 1 second, guys. Dietary shifts that support nerve function. Boosts vitamin boost vitamin 12 intake, B12 intake, crucial for nerve regeneration. Include fortified cereals, fish, eggs, and dairy, or consider supplements if you're over 60 and absorption is lower. Prioritize omega 3s found in fatty fish like salmon and walnuts, help maintain myelin sheath integrity. Avoid excess sugar and alcohol. They can damage peripheral nerves and worsen inflammation. Consider anti inflammatory foods. Leafy greens, turmeric, and berries promote nerve resilience. Physical activity for circulation and repair. Moderate aerobic exercise, e.g., walking, cycling, boosts blood flow to the nerve endings. Strength training helps with muscle coordination and protects against sensory degeneration. Balance and mobility routines. Tai Chi, yoga, useful for minimizing fall risks. Linked to neuropathy. Okay, stress reduction and sleep. Mindfulness and CBT based practices. Chronic stress elevates cortisol, which impairs nerve recovery. Sleep hygiene. Deep sleep is when most cellular repair, uh, including nerve healing, occurs. Neuroprotective habits. Limit exposure to neurotoxins, peptides, heavy metals, or chronic medication use, especially chemotherapy. Okay. Metals, mental stimulation, engage in cognitive tasks and creative activities to support brain to limb communication. Regular health monitoring, screen for diabetes, thyroid issue, and kidney dysfunction, all of which influence nerve integrity. Keep track of cholesterol and blood pressure to ensure vascular health, essential for feeding nerve tissue. Would you like suggestions tailored to specific aging profiles or how these habits could be integrated into smart housing environments? Given your interest in memory-friendly design and neuroplasticity, we could explore therapeutic technologies that that pair well with these lifestyle foundations. Absolutely, and uh, this links beautifully with your interest in cognitive resilience and therapeutic innovations. Effective stress reduction is more than just relaxation. It's about rewinding uh, how the brain and body respond to tension over time. Here's a multi-dimensional toolkit. Okay, body practices. These target both psychological and physiological stress pathways. Mindfulness meditation strengthens prefrontal regulation and reduces cortisol. Apps like Headspace or Insight Timer offer guided sessions. Tai Chi and Qigong, gentle movement with breath awareness, shown to improve vagal tone and emotional regulation. Yoga, particularly and restorative, combines flexibility with deep parasympathetic activation. Cognitive strategies. These help reframe stress and build emotional flexibility. CBT techniques, challenging autonomic nerve thoughts, commonly used in trauma recovery. Gratitude journaling enhances the anterior gang- gangulate cortex's role in mood stabilization, stabilization and visualization, coping, coping stress, success, mental rehearsal builds up builds adaptive capacity and confidence. Sensory therapies, and these use external stimuli to signal safety and calm. Music therapy, slow slow tempos, lower blood pressure and heart rates. Auto 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 Aroma therapy, scents like lavender and uh, bergamot act on the lymphatic system, ideal for bedtime routines. Weighted blankets offer deep pressure stimulation, grounding for those with anxiety or sensory sensitivities. Lifestyle anchors. These reinforce stable nerve system, baseline, regular circadian rhythm, aligns sleep, fosters melatonin production, and neuro detoxification. Nature exposure. Forest walks, gardening reduces amygdala reactivity, social connections, human bonding releases oxytocin, a natural stress buffer. Would you like a framework that integrates these strategies into memory friendly or frailty aware environments? Or perhaps how predictive behavioral algorithms in smart housing could personalize these interventions? I'd love to build on the synergy between your interests and these approaches. Mindfulness meditation isn't just a wellness trend, it's a deeply studied practice with measurable effects on the brain and body. Here's a breakdown of the science behind it. Mindfulness meditation activates and strengthens key brain regions. Prefrontal cortex enhances decision making, focus, and emotional regulation. Amygdala meditation deepens activity here, reducing fear and stress responses. Hippocampus supports memory and emotional resilience. Its volume increases with regular practice. Default mode network or DMN. Meditation quiets this network, which is linked to rumination and self referral thoughts. These changes reflect neuroplasticity, the brain's ability to recognize itself through experiences. Uh, Psychological benefits. Mindfulness influences body's stress response, reduces cortisol and inflammatory markers like cytokines, improves immune function with meditators showing stronger antibody responses, lowers blood pressure and heart rate by activating the parasympathetic nervous system, enhances sleep quality and melatonin production, mental health outcomes, mindfulness based stress reduction, and mindfulness based cognitive therapy have shown reduced anxiety and depression with effects comparable to antidepressants, improved emotional regulation, especially in trauma and addiction recovery, better attention and cognitive control, even in older adults, long term structural changes. Studies using fMRI and EEG reveal increased gray matter density in regions tied to learning and self awareness, thicker cortical regions associated with attention and sensory processing, shrinking of the amygdala, correlating with reduced stress. These effects can emerge after just 8 weeks of consistent practice. Would you like to explore how these findings could be applied in memory friendly housing or frailty aware care models, given your interest in neuroplasticity and their and the and therapeutic environments? We could even look at how smart technologies might amplify these benefits. And it's a natural extension of your interest in cognitive resilience and therapeutic design. Mindfulness often the key the the keystone, but there's a constellation of complementary practices that work synergistically to enhance mental health. Somatic and embodied therapies. Dance therapy promotes expressive movement and neuro emotional integration. Somatic experiencing helps release trauma via body awareness and grounding techniques. Progressive muscle relaxation. Sequential muscle tension and release reduces sympathetic arousal. Cognitive and expressive techniques. These reinforce psychological flexibility and emotional processing. Art therapy facilitates symbolic expression, especially useful in memory care settings. Okay, guys, so that is it for now. I'll be back on in a little bit with D for you. For now, Gator Wellness. Take care, folks.